Hi, my name is Renee McPherson, and I'm going to be going over the political and the ethical aspects of My Lobotomy by Howard Dudley and Charles Fleming. So first, in the political perspective, talked about Dr. Freeman and his work ethics and personality traits. So Dr. Freeman versus the doctors now is his work ethics. He used to take pictures of his patients while undergoing the procedure. It actually caused one of his patients to die during this procedure going on. And he's continued to do it. He continued to do it. Now, doctors, they actually wouldn't do that. They would have their nurses take pictures, or sometimes even have it being recorded by somebody else. He also would announced that a patient was improved or cured when they had just finished their procedure, which most of the case this wasn't true. He only did this because their bad symptom was gone, and he never tested to see if there was any other problems. Versus doctors now, they undergo procedure, they let you stay in the hospital for a little bit longer to make sure they run through some tests that nothing's not wrong with you. Dr. Freeman's personality traits were also a little bit different from doctors now. He really wanted to be that doctor who seeked this fame for doing the lobotomy and, of course, improving people's stress and depression through doing this procedure. So down to the lobotomy, he used the ice pick, which the procedure was about 10 minutes, which now we know that usually procedures, they're over a couple of hours. The effects of doing the lobotomy caused some of his patients to go into mental institutions, which then mental institutions, they were the patients were drugged and shackled, also kept in straitjackets and locked in rubber rooms. Versus now, doctors actually try to help the patients. They run them through therapy, researches. They still give them pills to calm them and relax them. But they try to seek them that way they can open their eyes and see a new light in reality. And Dr. Freeman, he was just the cause and didn't really care about the effect that it caused his patients to become mentally ill. Lobotomy are rarely used now. They're rarely used. Now they actually do shock therapy and psychosurgery, which is a surgical removal of specific regions of the brain. Dr. Freeman also used to carry around a portable electric shock, which he doesn't have, well, it's not going around anymore. On to Howard Dudley. The controversy was that he was too young of an age. He was only 12 years old when his parents thought that this would be the right procedure to control his behavior. And Dr. Freeman also had diagnosed Howard with being having schizophrenia. He only diagnosed him with this with only a couple of interviews, which we know now that to diagnose a patient with schizophrenia, there has to be researches, studying, and of course more than a couple of interviews to get the right answer. Then versus now, I believe that if Howard Dudley was in this age, he probably would have never, of course, went under the lobotomy. He probably would have went through some researches, maybe through some therapies and classes to control himself. And at the time, he was still a young kid, so maybe this was just an acting out of him being a child. Onto the ethical part, there's a lot of insights in the book and that Howard Dudley explains. The book explains how lobotomy was used, so it is ethical because they have statistics, they have ratings, they have past and present situations that had occurred. Also, there are pictures to prove the point. There is a picture that Howard Dudley laying down on the table, and Dr. Freeman sticking the ice pick by his eye socket. Also, Freeman was very unaware of the harm he caused. He was really seeking for the media to expose his work ethics and how he had became basically the doctor that could cure stress and depression through doing the lobotomy. It's not to say that Freeman was unsympathetic or didn't care for his patients, but we'll just say that he mostly cared that he did this procedure to make a name for himself. And the media, of course, had some effects to do with that. There's also records that Howard Deli had found to do his research. That's how he got to write the book. So he got to find some records, files, and also filings of other patients, which leads to the last discussion. As for Howard Deli, even though he had went through some triumphs of being into alcohol and homeless, he ended up getting himself together, as the lobotomy only affected him not as much as his parents not giving him enough love or treating him different from his step siblings and siblings. So the other patients, they were sent to mental institutions, or they passed, such as Rosemary, who was Kennedy's, the president's sister, and she was treated by Dr. Freeman, which is true, and then sent to a mental institution and later ended up dying there. So if this story is ethical, yes, it's real ethical because it has accurate information that shows sources and credibility, that the lobotomy was true, Howard Deli's experience was true, other patients were as similar to Howard, maybe some ended up as worse, and the working of Dr. Freeman's from others' point of view, especially it being controversial, was a main topic. Thank you.